about 40% of women have the metabolic syndrome. High blood pressure, we are now calling 130/85 pre-hypertensive, and it's worth paying attention to. Medications at 140/90 or above. And for people who have multiple risk factors, we really want to keep that blood pressure less than 130/85. 65 million Americans starting at age 6 have high blood pressure, and 1 in 3 adults have it and don't know they have it. And that's why it's called the silent killer. At age 60, 50% of people will have high blood pressure, and as I say, which side of the fence are you going to be on? My whole comment is train for menopause like you're training for the marathon, because if you don't, you're going to end up with high blood pressure. Those women that have high blood pressure during pregnancy, not preeclampsia, but borderline high blood pressure, end up with the risk of heart disease later in life. And we saw these in a test called a calcium score, looking for plaque in the arteries. So for women in their 20s and 30s who do have high blood pressure, these are women who are at risk. Again, a woman being a whole being and looking at her throughout her life is important in determining who's at risk for heart disease. One of the ways that we can deal with high blood pressure is reducing sodium in the diet, and a 10% reduction of sodium per day prevents 28,000 deaths and $7 billion in healthcare. And look at these food groups. This is where most of our sodium is. It's in cold cuts and breads and cured meat, pizza, poultry, soup, sandwiches, cheese. I think it's everything that we really crave right before we get our periods. Think about that. But if you cut back on salt, it really does actually matter. About 2,300 milligrams per day is what's recommended. Cholesterol, there is so much controversy that it actually makes me crazy. People are like, it doesn't matter, statins are bad for you. The reality is, if you have high cholesterol, whether it be LDL